So in a way, their textbook was the city of Charlottesville and the university itself. The organizations, institutions, and individuals that really shape the politics here in Charlottesville. And the projects are really conceived of as the first stab at thinking through a new kind of syllabus, a syllabus for the whole university, a syllabus for orienting students to the relationship between the university and the community that labors within it, that lives around it, and that bumps up against it in all sorts of different ways. So the question that all of these projects that you'll see are attempting to answer today really is, what should UVA students know about UVA in Charlottesville when they first step on grounds? So this symposium is conceived of as a starting point for thinking about how future students can become organized around issues and how they can better understand themselves as part of an ongoing politics, indeed a fraught and centuries-long and inseparable connection between the university and the city of Charlottesville and the state of Virginia. So the structure of the symposium today is as follows. We've basically organized the different projects into panels, and very generously faculty members from UVA have agreed to moderate these panels. So the panels will present, and the moderator will basically ask a broad question to all of the presenters, which is basically a beginning of a conversation that we hope you will join in for a short Q&A session. But unfortunately, these panels are brief, only 20 to 25 minutes in each case. So that's why we very much hope you'll continue to join us in this conversation over lunch, because surely not all of what we want to say will be said in the Q&A session. So we'll begin first with the first panel of Brian Cameron, Ali Arnold, and Morgan Feldenkris, who are going to talk about housing and the university, along with Eileen Chen, who's going to be talking about concentration of market power at the UVA Medical Center. And commenting on them will be Barbara Brown Wilson, a professor in the School of Architecture and an expert in sustainable community design and development. And she studies the relationship of social movements and the built environment. So I'd like to invite the panelists to come sit up here, and Barbara as well. Great.
Cool. So the housing group, will start. I'm Allie.
I'm Brian. And I'm Morgan.
And we're going to talk about student housing and displacement in Charlottesville. So across the nation, housing policy has had a pretty racist history. And here in Charlottesville, the story of Vinegar Hill is a pretty clear illustration of that. Many of you probably know about the story. It's pretty widespread in the narrative now. But it was an urban renewal project in 1960 that completely destroyed primarily black commercial district as well as residential district. 500 were destroyed, dispersing these residents across the city, many into public housing. And many of the public housing residents were located in 10th and Page and in West Haven, along with Friendship Court, among a couple of others. And so we took a look at 10th and Page and Fifeville because they're just adjacent to UniverCity. And these are historically black, primarily low-income neighborhoods that are seeing pretty widespread shifts in recent years. A lot of graduate students, venture capitalists, kind of this younger working professional class has been moving into these neighborhoods, and the demographics have shifted to a younger, whiter, generally higher educated class of folks. And as you can see from this quote here, many residents are voicing tensions and concerns about what these shifts are going to mean for these neighborhoods. In many cases, the tax revenues are going to increase along with property values, and many longtime residents are concerned that they aren't going to be able to afford their homes. Along with these kind of more nebulous social and cultural shifts that these changing demographics are going to bring.
So a lot of what we wanted to investigate was not just like when people move in who are affiliated with the university, but also the university itself's role, how its policies affect these neighborhoods. So first of all, what we wanted to investigate was student housing. Where do students live? A lot of times students live down 14th Street, down Wortland Street, and especially in recent years down West Main Street with these enormous apartment complexes, the Standard, Uncommon, the Flats. And so we were thinking, these are right next to neighborhoods. These are clearly increasing property values themselves and also that sort of cultural displacement that's going on. And so when we looked at the data, we actually realized that UVA itself had been investing heavily in first-year housing without corresponding shifts in second, third, and fourth-year housing. As you can see from the graph in the top left, as the UVA student body grows, its availability of on-grounds beds has stayed almost exactly the same for the last 20 years. So where do these students go? They go down 14th Street, Wortland. And it's not just undergrad students, it's also graduate students who end up living in these exact neighborhoods, 10th and Page, Fifeville, where they can find cheap properties, sometimes demolish them, sometimes renovate them, thereby increasing the property values in the neighborhood. And UVA has continued, as we saw in the new dorms, sort of renovations to increase its housing stock for first years, thereby incentivizing new students to come in. But it's clearly not doing enough for other older students. And as you can see here, it's not just student housing, it's also hospital expansion. This map we have here, the darker red areas are the ones that are built most recently. And as you can see, UVA is growing closer and closer and closer to these exact same neighborhoods that are already so tense and so vulnerable to these sorts of expansions. Moreover, the grayish, bluish, I think it looks differently from down here, is properties that UVA owns but is yet to develop. So you can see that it's not just what's currently in the landscape, currently in the UVA's built landscape, but also what is going to happen in the future. And for one of the first times ever, UVA actually has properties that are across the railroad tracks in Fifeville itself. So it's a worrying future and one that UVA should definitely take a closer look at to try and help these residents that it's potentially about to displace.
Yeah, and so here we're going to have a visual display of some of the consequences of the growing, booming student population without much significant added dorm space. So I would direct your attention to these highlighted areas here. We can see in 1994, a lot of them began as brownfields, or single-family home areas, or low-rise commercial districts. As we go through 2006, and then up to the present, we can see this, a booming development scheme here. We can see, along West Main Street, the archetypical standard, the flats on Common have gone up, and since that's directly adjacent to 10th and Page and Fifeville, that has the consequences of property value increase and tax bill increases on those adjacent neighborhoods, which has, a displacing effect. The development on Wortland Street quite literally built the wall dividing the student utopia on Portland between the adjacent predominantly black neighborhood, 10th and Page. So yeah, we can just see a very clear student growth machine here. And then kind of looking ahead to what's on the horizon, one of the big developments that we looked at was the Brandon Avenue Master Plan, which as we can see here, Dean Alan Groves described as a great western land grab for the university. But what's kind of significant about this is this is like one of the biggest student housing developments that the university is currently touting, but it's only supposed to add about 500 beds to the on-ground student housing stock. But we're also talking simultaneously about a gap of 10,000 students more live off grounds than on grounds. So this is very much just like a drop in the bucket, and we can even kind of think about this, sort of, big ritzy Green Street development as maybe like another commodity that the university is going to try to offer to like incentivize and attract students to the university in the future. So kind of wrapping up, we think that students can and should advocate for more on-grounds housing from the university. UVA has an $8.5 billion endowment, so it's not like the resources don't exist for the university to more creatively invest in these sorts of things. And it's like, certainly time for the university to think about doing its part to mitigate its negative externalities and its in the community, and think about preserving culturally significant neighborhoods like Tenth and Patient Pike.
Just pull it up by Hi, my name is Irene. I'm in third year, and today this group focused on the spatial expansion of the University of Virginia, and I wanted to touch more on the business expansion of the University of Virginia, specifically with the medical center. So just a little disclaimer, I first started out wanting to look at wage distribution in Charlottesville and doing that specifically through the UVA Medical Center. But as I started going through this project, I started diving more and more into the intricacies of our healthcare system and hospital mergers. So this is something that's relatively new to me, but I've learned so many really interesting things that sometimes I think we overlook when looking at the UVA Medical Center. And one thing just I think is really important to point out off the bat is how important the UVA Medical Center is to the financial status of the University of Virginia. Patient revenue from the UVA Medical Center alone accounts for 45% of every year's annual revenue. So that number should be enough for us to take a second look at exactly what's going on at the medical center and what its operations are. So first, just an overview of what the UVA Medical Center or the hospital system even entails. So the UVA health system is an academic medical center, which means that it's in charge for teaching students, doing research, all in addition to treating patients. And this makes academic medical centers incredibly expensive to run because, especially when affiliated with a school like the University of Virginia, it is expected to have, very high level research on maybe more obscure subjects, hire excellent faculty, and also treat the public, often low income individuals who may be under or uninsured or rely on Medicare. And so understanding the UVA Medical Center and its expenses will help us understand why it's deciding to pursue some of its business decisions that it's decided to undergo over the last 10 years. So for my project, I looked at two main data sources. One was public wage data of the UVA Medical Center. And this is some of the results I found. I just want to preface this by saying that these numbers look really bad, and they are bad, but also this medical center data didn't account for jobs that might be part-time jobs or jobs that are not meant to pay a full wage. So especially the range of $10,000 to $35,000, people who are making that income from a hospital job, that might be a little bit misleading. However, that still leaves a huge percentage of individuals who work at the UVA Medical Center still making under $60,000 a year, which is the United States average median income. And so at the UVA hospital itself, we can see a lot of individuals who are not paid that well, but then at the top, they're paid significantly more than others are paid at the medical center themselves. So already in the present day, we see wage disparities within the UVA Medical Center. Another important note is that the public wage data of the medical center does not include those who do nutrition services or janitorial services. Those services are contracted out, and so that data is not even included in here. And I would really love to see more research done about the contractors to the UVA medical system who so often talk about earmark. So I talked before about how running an academic medical center is very expensive, and there are certain things that have made running it more expensive today. So one is decrease of federal and state funding to universities in general. I looked at the UVA financial reports from 2010 to 2017, and one of the first subjects that was reiterated time and time again is that state funding, especially when there's a lot of uncertain politics, when there's sequestration, and when there might be hitting the debt ceiling, and things might not be fully funded. There's a lot of uncertainty, and the university can't rely on federal funding as much as it can rely on private funding. And so that changes the university and the University Medical Center's interest away from public to the private. The second thing is, as part of its expansion, the University of Virginia, along with other AMCs, have been rapidly merging or acquiring or partnering with other hospitals in its state in order to obtain regional dominance and get better leverage with insurance markets, with suppliers, with contractors, to be financially solvent. And so UVA Medical Center, for one example, has partnered with Culpeper Regional and a company called Novent, which has 4 huge hospital systems all over Northern Virginia. And so the UVA Medical Center is expanding into Central and Northern Virginia, and this really impacts the impact that UVA Medical Center will have across the state. And that's something you need to think about too, the spatial and the business expansion of UVA. So what kind of impacts will these changes have? Well, first, one thing I didn't really address on is that the UVA Medical Center also really wants to focus on making sure it's top of the field of a few specific regions of health. So that's orthopedics, vascular, child medicine, and so highly technical specialized professionals will continue coming into Charlottesville, which puts pressure on housing, which puts pressure on the cost of living here. The other impact is that as mergers and business deals increase in complexity, more costs will go to administration, and managing all these business deals are, multi-million dollar deals. Additionally, as mergers and hospitals consolidate, workers in hospitals, especially low-wage workers, will have less leverage over these these businesses, which are primarily turning into private sources of funding and away from the public. So there may be more accountability issues. So this looks a little bit grim, but I think it's just important to consider how UVA Medical Center's decisions will impact us here as well, and likely continue to exacerbate the wage gap that's in Charlottesville.
Thank you all so much. I'm so happy to be participating in this, especially with this big question about, what should UVA students know about Charlottesville when they first step on the grounds. And I feel like you all, I can see the passion that you've taken to trying to dive deeply into some of these questions that are often really hard to uncover. I mean, I can feel you like in the weeds of all of these reports and trying to make sense of some complicated mergers, and I'm learning a lot, so thank you. What I also hear as a theme is that there are, concentrations of power, and by our public institution that is also an anchor institution in our community and has a public purpose. And so kind of relating this sort of theme of a public purpose, and especially in a world, I was really taken by your quote from 10th page resident James Bryant, that he feels like a stranger in his own neighborhood, right? There's this like spatial imaginary that is also put on communities that you manage to capture. So tying these things together, what would you say needs to be added to the student, sort of, what is it, first year orientation? What do they need to know to help contribute to this dialogue? You do have to answer.
Yeah. Well, first of all, I think that, like how Allie was talking about Vinegar Hill, that seems to be, I think for a lot of us in this class and also also a lot of members of the audience here probably, people who are engaged with Charlottesville and like asking these questions, it seems almost like obvious, like default knowledge. But what I've been struck by is how little the average UVA student knows about Charlottesville history in general. And I think just starting out, students in their first year with a general base of knowledge where they can, like this class, like extend into different specific subject areas of interest would be a really good start for UVA to start like engaging with the Charlottesville community in a more equitable way, I would hope.
Yeah, I think like you said, I think incorporating these sorts of issues and questions into the curriculum, I think, is a really key area, especially for first years. Because also when we think about how the university houses students physically, the one time of your college career where you are guaranteed housing is during your first year. So kind of in terms of your physical space, it's almost as if UVA, it kind of creates an environment during the first year where they actually don't want you to think as much about the social and cultural impact of the university. So the classroom very much then is an imperative realm for those questions to arise, because otherwise you're not going to think about it when you're living on Alderman Road or McCormick Road, so physically separated.
Yeah, it took me a second to think about your question, because I don't think first years really need to know about all these hospital mergers that are happening. But I think it's continuing off of what Brian just said. I think it's also the idea that what might be beneficial for us as students or beneficial for the university is not necessarily good for others. So like when the university is expanding its class size of students, that's something that we would like. It's also might help with acceptance rate, but at the same time, that's not good for Charlottesville. So I think it's just more critically thinking about, okay, these nice amenities are being built for us, but what's the trade-off, and building that critical thinking skill.
Well, we probably need to move to the next panel. We weren't kidding when we said there would be so many questions that we'd leave on the table. So I hope you'll join me in thanking this terrific beginning. All right, I'd like to invite Andrew Norman, who's going to be talking about outsourcing and Aramark at the university. Sean Warma, who's going to be talking about dining halls at social and workspaces. And Sydney Bradley, who's going to be talking about food insecurity in Charlottesville, as well as Corey Shaman, who's going to moderate. Corey is a professor in the English department and is concerned with food systems and food insecurity and environmental justice, particularly in the U.S. South. We wouldn't be humanities professors if we weren't fumbling with a PowerPoint embarrassingly in front of an audience.
Could we just make a quick comment while you're waiting to get?
Oh, sure.
Professor Denberg's lived here since 1968. I've lived here since 1976, and these processes have been going on since then. And one of the things with the research is when the UVA outsources things, those organizations don't have to pay, or we don't know. I don't know if they pay health care and other benefits that if you are an employee of the university, you're a state employee and you're required. Just a couple thoughts about that. But the housing thing's been going on for a very long time. It's just escalated and become more gaudy.
Yeah, I can go. Okay. Alrighty. I'm just going to pull this up here. My name is Andrew Norman, and I'm a fourth-year student, and I'm going to talk to you all today about outsourcing on Virginia campuses, in particular public universities in Virginia. For those of you who are kind of unfamiliar with the concept, outsourcing essentially describes the practice where a university, in this context, contracts out non-essential services to a private company. Now, among the services most typically outsourced at universities, bookstore services and dining are typically the most common. But at UVA, I think the most, I should say, serviced by Aramark, and it's been somewhat of a point of controversy over the history that Aramark has been here. Essentially, primarily through the living wage campaign, Aramark is kind of infamous for not paying its employees a living wage. And having been a student who received a dining plan here, I can say the food is kind of average, and it costs about $12 a meal. I can go to the grocery store these days and eat for $3 or $4. So one question I want to ask, or one thing I want to talk about now, is if I'm going to pay $12 for a meal, some of the things I would expect this service to provide would not only be a living wage for the people preparing that food, but also that food is locally sourced and raised and farmed in environmentally responsible methods. Moving on, there are other options. Let's go. Okay, let's see. I'm gonna skip ahead here really fast. Like I was saying, there are other options than Aramark, where you go and get kind of a refried patty on a bun. This is a plate that I had a friend send me a picture of that was served at Virginia Tech last year. And just to give you guys a point of reference, that is environmentally responsibly raised rainbow trout, farmed in Southwest Virginia, combined with asparagus and rice grown on a farm that is managed by Virginia Tech students. And I hate throwing the Hokies a compliment, but I'm a little jealous. So moving on, why do we do business with Aramark, this company that's sort of infamous for not paying its employees and serving pretty mediocre food? And if you look back at the history, you'll find that most of the universities in Virginia that outsourced their dining services did so in the late 1980s and the early 1990s. Now, there are a variety of motivations to outsource, but given that short time period that most of these universities outsourced, you'll find UVA outsourced in 1988, as did George Mason University, and most other universities followed suit by 1992. During that time frame, the Virginia State Legislature did cut a variety of funds that they were providing to the university, but in particular, they encouraged the universities to slash the number of employees that they hired, primarily because they were paying a lot of money to these people's benefits, essentially. So, if you go back and if you talk to the Aramark employees here, they will tell you Virginia outsourced because they didn't want to pay people's insurance, essentially. Now, that seems to me like a little bit of an inadequate answer. It's definitely part of the problem. I have here a history of public funding provided to public universities in Virginia. That solid blue line represents funds provided by the state of Virginia. The dotted purple line represents federal funds, and the green dotted line at the top represents the sum of both. And you'll notice that over the past several decades, the amount of public funding available to universities has maintained somewhat of a steady level, if not a slight increase. Now, that has led me to believe that the main reason that universities outsource is because universities in the state of Virginia are growing. They're getting more students, more people are going to college, more people are seeking degrees. And with those increasing numbers, dining halls need to get bigger and more food has to be prepared. Now that response in essentially building more dining halls and making the dining halls that exist get bigger, they often have to spend millions of dollars. And so one thing, if you take a look This is James Madison University, by the way. I just wanted to throw a photo up there and say that outsourcing does work sometimes. That's good food, right? Outsourcing, let's skip ahead actually. There we go. If you take a look at the UVA contract that exists between Aramark and the university, Aramark essentially not only provides dining services, but it grants UVA a certain portion of sales every year, and it allocates a fixed sum to renovating dining halls. Now, this saves the university a fat amount of money over the course of this contract. Between 2034, Aramark's going to spend $6 million on dining hall renovations. Now, that brings us to another question, which is why can't we do this ourselves? As mentioned in the previous panel, the UVA endowment is over $8 billion. We're sitting in a building that was built during the time that outsourcing began at this university. And essentially, what I'm going to say is that we don't need to do it ourselves. Outsourcing can be a responsible solution, but we can ask for so much more than what we have. Those things I talked about at the beginning, sustainably sourced food, a living wage, these are not unrealistic expectations of our dining services. Now, we're trapped into a contract until 2034, so we're not going to be able to do much of anything for a very long time. But what we as UVA students can do is keep this a pertinent issue, and when that contract is set to expire, instead of looking for fancy new dining halls, we can instead ask for, like I said, a living wage and sustainably sourced food. And if Aramark is not willing or able to provide those things, then we can seek, through a competitive bidding process, a better option. I'm going to say that again. A competitive bidding process is really what's going to make outsourcing be a responsible solution at the university. We can continue to spend and allocate our funds to academic projects and fancy new buildings, but we need to hold our university more accountable, and we need to hold our contractors more accountable. So, thank you.
Hello everyone, my name is Sean Gormith. I'm a fourth year student here at UVA. I'm be following up on, probably continue on our previous topic. And so I've started off last semester looking at the invisible barriers of healthcare access. And for this assignment, I decided to take a step back and to look more at my own personal experiences and to look at these similar invisible barriers to a equitable university experience. And I did a case study in various dining hall spaces. So my methods for this were to conduct a case study with field notes, silent observation, and being more aware of how I interact with workers and other students. And this also included anonymous interviews, which I made sure to remain anonymous because Aramark has a tendency to threaten employees who seek to better their own working environment. The framework with this was that I recognized that working conditions here are less than ideal even at such a prestigious university. And in my time, I've personally seen workers berated, disrespected, and overlooked by supervisors and students alike. And to continue on to this framework, this is pretty much a way I see how we engage with these invisible barriers, starting with the simple self and other, followed by interacting mechanisms with socioeconomic status, the identity of yourself and the other, personality, your mood, academia, credentials, previous work experiences. All these coalesce to how we engage with people in certain settings, in certain contexts. So in my observations, I looked at 3 different places: Newcomb, Fresh Food Company, Observatory Hill Dining Hall, and Crossroads. So Newcomb, in my case study, I recognize the most number of positive interactions here, which really has to do with the service workers in the front, and also I believe a lot of attention is given here just because this is where most of the parents and students go to during the event Days on the Lawn, where so it's really brings prospective students. So UVA really gives and Aramark really gives their best presentation. Observatory Hill, one thing I was happy to recognize that it has the highest number of international workers and resettled refugees. There's also a good and bad to that. On the good side, there's students who donate their time, who volunteer their time to tutor these workers and to talk to them about their experiences during their lunch breaks. But another thing I recognized was that I recorded the highest numbers of scrutiny from supervisors. So the supervisors really dedicate a lot of their time to correcting these workers and also Black workers. And for Crossroads, this is one that's open up till 2 a.m. So I spent a few late nights there, and I've seen the workers really have to deal with a pretty toxic environment sometimes, intoxicated students. And so here it's like a stark dichotomy between students really having fun and workers just trying to make it through the night. And to present the two different sides of work experience, but they're really one and the same, I want to present a tale of two servers. To the left, we have Miss Yvonne McGurson, otherwise known as Miss Kathy here at UVA, who's really rise up to a type of icon status here. Wields considerable power just because the student body loves her, adores her so much. And to the right, we have someone who I would remain anonymous even though that they no longer work here. Let's refer to her as Miss T. So a quote that really captures Miss Kathy's personality is from an interview in the Black Fire class. I just don't understand how if someone new comes, you shun them. If someone is new at school or someone's getting teased, go to that person to ask if you want to play with them. Don't leave them out because no one should be left alone. So this really shows her experience here where she came here another faceless worker just like everyone else, but the way that she chose to engage with students was to see them all as people and to always really dedicate some positive energy to them, which really probably really takes a toll on her if you think about it. Is there like at this point an expectation for her to be like happy and positive? And to the right we have Miss Tamika, who I had the pleasure to have an interview with her just because I just so happened to see her on the corner and asked if we could have a little time to talk. And in this conversation, she brought up that the average student is usually too busy to even see us as people, let alone care about local issues. A lot of Charlottesville residents work at UVA, and yet we're second-class citizens in our own city. So one thing that I want to bring up and I guess raise as a question is that the university totes Miss Kathy. Actually, there was some celebrity whose name is eluding me right now, who actually came to UVA and gave a speech and included Miss Kathy in the list of things to know about UVA. So perhaps this presents a false narrative that UVA cares about its workers or that its workers are happy. And I think this is something that students and faculty alike should really take into consideration as we move forward in the university experience. So I guess some takeaways for us is how we can perhaps move towards a more equitable university experience. And one, recognize that barriers exist between different categories of people. Two is be conscious of how we interact with these invisible barriers to people. And three is really up to the students and up to the faculty, unfortunately, because the workers are not in a position to advocate for themselves, to advocate for their better working conditions. Beginning but not limited to a living wage. That's all I have to say.
Hi, I'm Sydney, and I'll be presenting on food insecurity in Charlottesville. So first, food insecurity is a household-level economic and social condition of limited or uncertain access to adequate food. And it's about inequity, access, and place. But the definitions change nearly every year when new scholarship comes out about food insecurity, and when the USDA changes what they qualify as the classifications for being food insecure, but also the growing definition of food deserts. And so this project began with researching the prevalence of food insecurity in Charlottesville, which revealed that the city has one of the highest rates in food insecurity in the Central Virginia area, and the threshold of severity frequently showed Charlottesville on a map as being densely food insecure across the state of Virginia. And so this intersects with the rates of poverty in Charlottesville, which rests around 22%. However, throughout the preliminary research, definitions of food insecurity were numerical and objective, not accounting for the experiences and personal circumstances which contribute to and exacerbate food insecurity, which led to the question, what does food insecurity look like in Charlottesville beyond numbers and beyond USDA classifications? And so food insecurity in Charlottesville rests at a 16 to 18% rate, and that compares to the national average of 12%. And so this led to a case study of West Haven Public Housing as a specific location for food insecurity, especially with its contrasting location, but also income inequality compared to the student population right adjacent to it. And so a brief history and contextualization of West Haven is that it's a public housing neighborhood built and populated after the displacement of the historically black neighborhood and economic hub Vinegar Hill, which we spoke about earlier today. This public housing is reserved for those of low socioeconomic status and households raised from families that have 2 to 4 children, immigrants and refugees, and disabled. And although undefined by the USDA, it has exhibited and continues to present itself as a food desert. The USDA defines food deserts as a part of a county that are vapid and fresh fruits, vegetables, and other healthful whole foods, usually found in impoverished areas. And there's different classifications for urban and rural areas. And if one area is not urban, it is classified as rural and vice versa. And particularly, it accounts for the locations and types of supermarkets located in a geographical radius to certain housing areas. And so here is a map of where West Haven is located and its mileage to Kroger and the Barracks Shopping Center, which is 1.47 miles. Although it take different routes to get there, I have mapped different bus routes. And so located nearby West Haven is Ree's Supermarket, which is a very small supermarket, about 6 aisles, although including the radius of the building having food. However, compared to Kroger, Kroger has about over 20 aisles, as well as a Whole Foods and natural organic section. Ree's does not have baked goods and various large expansion of locally grown or fresh vegetables. And I did a comparison research project in which I walked from West Haven and shopped at Reed's and carried back groceries. And myself alone, I'm clearly very small, and I carried the groceries back, and it was, to have myself have that experience, my arms were sore, and can imagine having children walking after 5 and it's dark during the winter time. If it's raining and there's only one sidewalk on one side of the way from West Haven to Reed's. Additionally, the only bus routes that go from this area are the 8 line, which stops at a bit after 5 p.m. on weekdays, and the 7 line and trolley. And so the 7 line goes to Barracks, but is not completely accessible nearby to the West Haven neighborhood, and takes about over 30-minute drawn routine. And if you went to Kroger to go shopping, you'd have to go shopping, wait for the bus again, and then carry all of those shopping bags as well onto the bus. A point of comparison is which routes serve the university community and which routes serve the community that actually needs access to food. And the UTS routes, North Line goes into Barracks but only serves the university community, and the free trolley, which goes downtown and throughout the university road system, does not serve the local residents of 10th and Page and West Haven. Additionally, the inner loop and outer loop routes that go down 14th Street, Preston, and the rest of Gordon Grady area do not actually reach or the West Haven area or the 10th and Page district. There's a few stops on Preston that are open, but do not bring them to the shopping centers. And so this kind of describes food insecurity as really an issue about access and equity, and showing that comparatively the students are the ones being served here about access to the grocery stores, while not the residents who need it. And so another important note about food insecurity is how it's framed as an issue of personal circumstance and choice and laziness rather than exhaustion and circumstance. And so a story that was told to me was about a formerly homeless woman who was pregnant while she was homeless and was employed or she had her child. But food insecurity is very embodied here in that she had to drop off her daughter every day at daycare, then go to work, then pick up her daughter at daycare, then come home with little time to actually cook a meal or go grocery shopping. And so the most accessible, affordable, and able meal to cook was via the microwave with pre-processed foods. And throughout this time, she was using public transportation, which adds another compound of time and access that is both limited to those who are under low socioeconomic pressures and are food insecure. And so what is their, oh yes, that. And so future projects and promising initiatives are the local food hub, which has brought locally farmed goods to neighborhoods and residents who face dietary needs or food insecure. And so they work closely with the City of Providence and West Haven to package goods and vegetables, fruits, recipes, and bring them to the families, and has already proven successful in their dietary improvements and health. While also providing recipes in order to learn how to cook these foods and how to have them liked by children as well. And for those families living in West Haven who are new to the country, teaching them how to adapt to the American, what you can grow in American gardens and what's available in this region, while also teaching them how to read English and cook the recipes. And so the City of Providence is also tightly bound to the West Haven housing, and it's located right around the corner, and it has a garden in which the residents both grow and use. And in the summer, City of Providence has a school, a program for the children in which they pack lunches and bring them to camp so they can learn how to grow their own food, while also teach their families about these new dietary foods they can grow in their backyard, while also working with the community garden. And finally, UVA initiatives that have been working with West Haven, but also in Charlottesville in general, is the Growing for Change initiative, which was founded a few years ago. And they work only with West Haven and have backyard gardens with the families and teach them how to grow, and then also keep coming back and make sure they're growing the new gardens each year. And then a future plan is the UVA Community Food Pantry, which is a joint project of Madison House and Student Council. And although not completely understood what it's going to be like in the future, it needs to be understood by the students that they need to not only address food security of the students, but also the local residents, and making sure that the food pantry, with its fresh food availability, light goods, as well as dry foods, are accessible and visible to both students who are in need and local residents who are otherwise unable to access the proper and adequate foods needed to defeat or to mitigate food insecurity in Charlottesville.
One question. Yes. First, I thank y'all, and I'm really moved by the compassion and investment that y'all have. I think the entire audience can witness that. I'm really struck in all of your presentations by the everyday nature of injustice, and I think likewise the everyday practices of justice that I think are coming through in the work that you're doing, these projects, I think are efforts towards justice. And so to think through the kind of theme of the symposium, I'm really wondering what it means to y'all to be so intimate with injustice on the one hand, which I think that's latent in your presentations here. To be intimate with that injustice, but also so familiar with the efforts to make justice possible. The kind of very personal reaction.
I guess for me personally, these are like things that I noticed for a while now, and I really noticed that it's honestly about how you engage with these things that are mostly out of your power, out of your control, but also recognizing that just by the nature of like cause and effect, anyone can bring about change, even if it's like very small, even if it's just making one person's day better. Like anyone can do that, and also to be aware of the things that are perpetuating the problem to begin with. So maybe like changing a few of your actions that are contributing to the problems can bring about just as much change as going out and trying to face these problems head on.
I think food particularly is an interesting way to visualize and experience inequality and oppression, and it's difficult to understand the experiences of food insecurity if you come from the background, and we get to live a very privileged access as students with the BTS bus line to Corcoran and Cedar, which are marketed directly towards students. There's UVA signs all over those grocery stores, and they have student discounts, but that spatial and economic isolation of who stores are marketed to is something I'm not sure if we can directly change as students, but I think through engagement with activities like Growing for Change or the community pantry, in understanding our role as students in the spatial construct, while also providing accessible foods, but also maintaining the health and nutrition around us, because it needs to be a communal effort and a public health issue.
I think my fellow panelists did a great job outlining how university students kind of, like you said, have a daily interaction with an injustice on campus. But I think one thing I've learned a lot about during my project was the idea that over the last several decades, universities have been treating students less like students and more like consumers. And I think people talk about that as a bad thing, but I think being treated as a consumer is actually an incredibly empowering thing. We as students can cast votes for what kind of school we want to go to with our dollars. And for me, that means not having an Aramark meal plan. But it also means being vocal and just reminding people that these people who work on our campuses are not second-class citizens. Thank you all very much.
This next panel that I'd like to invite up is Matthew Sallet, who will talk to us about infant mortality in Charlottesville. Elizabeth Adler and Olivia Hampson, who are going to be talking about reproductive justice and accessibility. And Jennifer Irwin, Bhakti Raval, and Lily Mullins, who will talk to us about the unaffordability of daycare for Charlottesville's near poor. And commenting on them is Professor Jamie from the Miller Center, who has written extensively about federal and local anti-poverty efforts. And this panel is really apt to follow on from the previous conversation about the personal and embodied, physically embodied nature of inequality in Charlottesville. Matt.
Hi, my name is Matt Sallet, and this semester I looked at infant mortality in Charlottesville. I specifically looked at how race matters, place matters, and space matters for birth outcomes in Charlottesville. So first, I'm going to define infant mortality. So infant mortality is the death of a child born on her first birthday, and it's considered one of the most important measures of the health of a community. And as you can see by this graph, overall, in the last 15 years, Charlottesville has seen a decrease in infant deaths. But race matters. Black babies die at twice the rate of white babies. But an important caveat to that is that race is a social construct. So black babies are not biologically predisposed to dying more often. It's the experience of racism that their mothers have from preconception through pregnancy and infancy that causes these disparities. And in Charlottesville, place also matters. The zip code is an important predictor of health outcomes, and your access to transportation, safe housing, and healthy foods are all social determinants of maternal-child health that have real impacts in Charlottesville. As you can see by the map, you have to travel all over the city to access different resources that you would need throughout your pregnancy. And the average mother in Charlottesville has 13 prenatal visits, and that's a lot of doctor's appointments for anyone. But those problems are even more exacerbated when you don't have consistent transportation or when you're reliant on public assistance. Because if you have to enroll in Medicaid and WIC programming in order for your child to have adequate health care, those 13 appointments can easily become 20 or 30 appointments. And the final place of my presentation of this map is actually the UVA health system. And at UVA, and that makes sense. It's the #1 hospital in the state. It's a leading center for maternal-child health. We have one of the best neonatal intensive care units. If anything were to go wrong medically, this is the place you want to be. It's world-class doctors that are providing equal care in 2018 for all patients. But that has not always been the case. UVA Hospital was segregated until 1964, and until the 1950s, all African American patients received care here. This is the basement of the hospital. As you can see, it is a disgusting picture of what it would be like to receive care. And the distrust that African Americans feel at the UVA health system is also tied to research. So UVA has been a center of eugenic studies throughout the 20th century, and it's also the training place for the scientists that conducted the Tuskegee syphilis study. And that distrust has remained in place throughout the 20th century into 2018. So in 2014, Dr. Michael Swanberg at the UVA Nursing School conducted interviews with African American mothers about their experiences receiving prenatal care at the hospital. And the #1 reason that they didn't access prenatal care to their full ability was distrust of providers. And that makes sense. People learn about their experiences of receiving prenatal care from their mothers and grandmothers. And if their grandmothers were receiving prenatal care and giving birth in the basement of a hospital, then how are they supposed to trust these physicians to provide them with adequate and equitable care? So this is actually a quote from one of the mothers. So you don't want to go there, you don't want to deal with them, but what other option do you have? I need them. And that's the gist of this whole problem, is that you have to go to the UVA health system to receive this care, and you should want to go to the UVA health system. You're going to get the best care, and Black mothers in particular have this double bind that they're facing. So they feel the discrimination as African Americans receiving care and as females receiving care, but they don't have a choice to opt out. They need to go see a doctor. They can't just have a backache and put off that pain, because going to every one of those 13 prenatal visits is crucial for their baby to have the best chance of having good health outcomes. So knowing all this information, where do we go from here? Well, Charlottesville is already doing, as you saw in the first slide, a good job of reducing overall infant mortality. And the goal now is going to be to close that gap between Black and white babies. So the Improving Pregnancy Outcomes Work Group is a collaboration of physicians and nurses and social workers and nonprofit organizations and a lot of people in Charlottesville that are committed to maternal child health equity, that are doing incredible work. And our role as a university is to support the existing institutions. So 3 areas that we can do that. Undergraduate students volunteer at really high rates through Madison House, and that's awesome. But we need to be mindful that our volunteer work is supporting existing institutions and nonprofits rather than creating more work for people that are trying to help these mothers. Next, we have a health system that, as we alluded to earlier, has a lot of money that can be put towards research. And I say that with an important caveat that historically we've done a really poor job of conducting research with and on African Americans. As I spoke to earlier, it's a center of eugenic studies and the training place of the syphilis study. That being said, Dr. Swanberg is a model researcher of how we can conduct ethical research in order to understand these issues and create viable solutions. Lastly, UVA is pushing towards pan-university institutes, and in fact, Professor Wilson, who was on a panel earlier, is one of the heads of the Initiative for the Study of Equity through Community Engaged Scholarship. And that Penn University Institute, or another one, could take on the challenge of infant mortality and dedicate resources across institutions so that we can move towards a more just community.
All right, so hi everyone, I'm Elizabeth.
I'm Olivia.
And we conducted basically a research project on the barriers to reproductive justice in Charlottesville and Central Virginia. And we found that the barriers can sort of be organized under 3 umbrellas. So the first is, sorry. Leave you hanging.
Firstly, I want to thank Matt because I think that when we think about reproductive rights and access, we really frame that on contraception and abortion, and a huge part of that debate is the right to dignified motherhood as well, and often gets left out. So, but continuing on, when we talk about reproductive health care, I think we're very focused on the language of choice, a woman's right to choose, and we don't really unpack what that means, and I think that's very reflected in like pro-life versus pro-choice, that dichotomy, and sort of how we identify ourselves as one or the other. But that lens makes the assumption that everybody has a universal access to choice. We're making that right off the bat. And so our project really wanted to look at and identify some of the barriers that illuminate the structural obstacles to the luxury of choices.
So first umbrella is sort of socio-economic barriers.
So an abortion costs upwards of $400. That's a baseline. And that just rises and rises based on how far along you might be or any kinds of medical complications. But when we think about abortion, if you isolate it only to that medical cost, then you're really missing out like most of the problem. That doesn't include travel. There are a lot of abortion deserts, particularly west of Charlottesville, so many patients that need reproductive health care are traveling a long way to get it. That doesn't include taking a sick day from work, which because there's a 24-hour waiting period between your mandatory 2 appointments, that means 2 days off of work. If you already have children, that means overnight childcare. So all of these things just stack on top of each other to create a very important financial burden to receive a doctor's appointment. Planned Parenthood does treat patients with a sliding scale of payment options. And that applies not only to abortion, but to contraception, STD testing, anything that they do. But obviously, as they receive less funding and as they receive less patients because of the barriers that I already addressed, that ability to sort of compensate a person's ability to pay them is shrinking. What we do have is the Blue Ridge Abortion Access Fund, which is very helpful to people in Virginia, and things like this exist nationally as well. But all of these things are becoming more and more squeezed and losing their ability to fill the gaps.
And so Olivia already mentioned some of these, but these are the legislative and regulatory barriers that bar women from accessing reproductive justice. And so I can just go through them and give a little description. So state-directed counseling and informed consent, those quotes are pretty intentional. So these are where state legislatures have basically written a script that doctors have to deliver to people who are pregnant and seeking an abortion before they are able to access an abortion. And so this frequently includes inaccurate medical information and often really explicit descriptions of the abortion procedure intended to discourage a woman from choosing abortion. And often, I actually listened to it at the Whole Woman's Health Clinic in Charlottesville, and often it involves a doctor reading it and then contradicting herself like every other sentence. So it really leads to a kind of confusing and detrimental environment for people who are seeking abortion. Third trimester restrictions. So these are you're only able to get an abortion during your 3rd trimester if your life is at risk. And
and this kind of excludes a wide variety of scenarios, including like fetal abnormality, which are typically only detected in third trimester testing after 22 weeks, just because of the way that healthcare is situated and how the way that the medical profession has advanced. And so this leaves out a lot of reasons why women might choose to get an abortion. And then there are insurance restrictions in the form of the Hyde Amendment, which prohibits any federal funding from funding abortion, as well as Medicaid. So different states have different policies on whether women who are on a Medicaid plan can use those funds to access an abortion. But this kind of shows, this added financial restriction shows how these legal and regulatory barriers combined with the socioeconomic barriers really can compound on each other and give an added weight on women's shoulders. Parental consent, if you're a minor, you have to have a signed form from your parent or guardian. Mandatory ultrasound, these can, this obviously does have a medical purpose. The abortion providers do want to know how far along a person who's pregnant is before they're able to access abortion. However, frequently these are really invasive procedures, and the provider is required to ask the woman if she wants to see a picture of the ultrasound or hear the heartbeat. And this just seems really extraneous and undue, and very, again, not really having to do with the woman's health. None of these barriers are there to really advance the health of the woman the way that they are supposed to, or the way that they are said that they do, but really they're just extraneous and we need to add more barriers to prevent abortion, including the 24-hour waiting period that Olivia described earlier.
So as I already mentioned briefly, a big part of this is location. In 2014, 92% of Virginia counties had no clinics that provided abortion, and 78% of Virginia women were residing in those counties. Charlottesville is located in the Thomas Jefferson Health District, so Virginia's health department allocates regions to healthcare, and there are 250,000 people that are supposed to be serviced by this one health district. Within that district, there's only one Planned Parenthood and one Whole Women's Health clinic, both of which are located on Hydraulic Road, which I'm sure you all know is a very, very busy, huge road. The closest bus stop to that Planned Parenthood is half a mile down Hydraulic Road, where there is no sidewalk, only one bus that goes there, which I think is pretty self-explanatory that if you have maybe children with you or disabled, or even if you're an able-bodied person, that's a dangerous situation to be walking in, especially when you think of maybe it's dark, maybe it's early. And as other groups have already discussed, this does tend to disproportionately affect women of color who might have more prevalence to need this public transport, and or specifically from accessing these clinics.
Right, so we wanted to give you more context for this geographical barrier, so we have some maps here. So this is a kind of zoomed out view of the Thomas Jefferson Health District and the 2 abortion clinics that are within the Thomas Jefferson Health District, which are in Charlottesville, as you can see. So that's the Planned Parenthood and the Whole Women's Health of Charlottesville, and you can see they're really, really close to each other, which provides a wealth of access for women who are living in Charlottesville, who are maybe middle and higher income, but the surrounding counties are kind of left without that same access. But it's even worse when you actually consider the fact that the only abortion clinic west of Charlottesville is in Roanoke, and there's only one, and there's only one abortion clinic in West Virginia. So when you take that view, this is Western Virginia and West Virginia. So that's clear, sorry. and there's only 4 abortion clinics for this wide landmass, creating a pretty significant abortion desert in the land between those clinics. And then we found another barrier in the form of crisis pregnancy centers. So these are John Oliver just did a great bit on these. So these are health clinics that are really intended to persuade people who are pregnant from not getting an abortion. And they also typically use medically inaccurate information or just very targeted attacks. And they have more funding and support than any of these abortion clinics probably. And I guarantee that if you Google right now, Charlottesville pregnant, the first thing that's gonna come up is the pregnancy, or what is it, pregnancy? No, it's not pregnancy, it's like Pregnancy Center for Women or something like that, right on West Main. Every time you go to the downtown mall, you probably pass by it. And that's the first thing that's gonna come up. And so
so it's pretty jarring to see how many they are, no deserts there, compared to the abortion clinics, and you can even see a superimposed view of that. So they're pretty targeted to not just be extremely close to where the abortion clinics are, but also where the abortion clinics are not. Yeah, and so, just a quick, it's a little empowering thing.
Yeah. So we haven't talked that much about the university and the role that you as students can play in this. A huge part of this issue is misconception and stigma, and so as people, like, if you choose to educate yourself about this and just provide your body to clinics and go out, do what they ask you to do, canvass during election cycles, and just talk to people about the services that are being provided, what that means for the communities that have access to those services, and yeah, also donating to the Blue Ridge Abortion Fund and volunteering through Medicine House. They actually have a specific program for volunteering at Planned Parenthood in Charlottesville. So.
Hi everyone, I'm Jennifer.
I'm Lily.
I'm Betsy. And we're talking about education here in Charlottesville. So for this study, we began looking at the achievement gap. And the achievement gap is really a disparity in education between minority students and their white peers. And this is shown through grades, through standardized testing, and college applications is where you can see this difference. And it's actually, it's a problem throughout the entire nation, but it's most prevalent in college towns is where we see this gap just increase exponentially. So something about a university presence is adding to this, including at Charlottesville. So the studies that have been done to see what can address the achievement gap and limit that have been targeted at several different sectors of education, and it's far and away most beneficial to target before inequalities increase in education. So that is at ages 0 to 5, to provide quality care so that when children enter their schooling, they're on a level foot instead of already beginning off at an unequal stage and just having that completely exacerbated throughout their education. So that really brings us to looking more at daycares, because more and more women are choosing to remain in the workforce after becoming mothers. So they're letting their kids be in daycares for some portion of the work week. And this gives us two things to question when we're looking at these daycares is what is the quality and what is the access. So currently, right now, the average daycare that middle class and upper middle class parents are sending their children to actually are not providing the level of care that is required in order to minimize the achievement gap. In fact, it can actually have negative effects. So the level of care, the quality of care in these daycares significantly needs to improve in order to see any type of benefit. And then also the access of who can even get their child to a daycare is under question as well, because middle and upper middle class can afford this option, and those who are in poverty, they have public options that are government funded care, but there's a population called the near poor or the working poor who just manage to stay above the poverty line and thus get no aid from the government and still cannot afford to put their children in care. In fact, we ran some numbers from here in Charlottesville, there's a public care called Head Start that provides child care, and using the cutoff numbers per household, we ran what the metrics would look like to the daycares that they refer them to instead. That's supposed to be the closest option for near poor families to be able to afford. And depending on their income level and the amount of children they are sending to the daycare for 1 week, it could cost up to 99% of their monthly paycheck. So that's simply unaffordable and it cannot be done. So that's leaving these near poor families to come up with other options, such as a shift work or having to rely on a single income, which can be devastating for families.
Yeah, so as Jen mentioned, we really zoomed our analysis into this population that we identified as being the Nearport neither have benefits from the federal government and they can't afford the private options in Charlottesville. So we researched sort of a profile of Nearport to identify the most salient factors that pertain to access to early childhood education. The two that emerged were isolation. Nearport populations tend to be more geographically isolated and don't tend to own their own vehicles. So any daycare would have to be along public transit lines or provide their own transit to these families. The second is Nearport families tend to be female-headed households, and these women tend to work low-wage shift works, which don't necessarily map onto the exact opening and closing hours of daycare, which can transform into a real barrier when centers like Barrett Early Learning on Ridge Street have a $10 flat fee for late pickups and $2 charged each additional minute that the parent is late. So that $12, $14, $16 charge can be the difference between, sending your kid to daycare one week and putting food on the table the next week. So we contacted Barbara, the Assistant Executive Director at Head Start, and we said, what options do you refer the people who come into you and have maybe $5 over the minimum threshold? So where do you send them? And she said, we send them to United Way to get financial aid that can then fund their education at early childhood education centers. Or there's also a CVIL pre-K program, but the capacity really isn't meeting current demand. So just looking even more zoomed in at Benville Elementary School, there are already achievement gap differences emerging in 4th grade, where Black students are passing the math SO in 4th grade at a 51% lower rate than their white peers. So that really reinforces the need to shift policy interventions from K through 12 to early childhood education.
Yeah, so to talk about this issue in relation to UVA and some steps forward, Nearport families face a lot of hardships, and to only add to this, since UVA is the largest employer in Charlottesville, it's pretty safe to deduce that many of the families living in near poverty work here, and while they're providing services to UVA students and also faculty, they're often doing so at the cost of providing their own children with an education. Due to the issues of affordability and access that my group members pointed out, many of the young children of workers at the university oftentimes are either staying at home or accompanying their parents to work. So as other group members have also pointed out, UVA students are often unaware of the overall impact that they have on Charlottesville, and we really do think that there's an obligation here to help. So in this regard, UVA already has some pretty good initiatives in place, but they largely disregard the Nearport population that we're talking about. So through some research and conversations, we found 2 ways that UVA can possibly help. One example is the Curry School of Education. They have a Day in the Life service initiative, which basically sends students who are enrolled in the teaching as a profession class into Charlottesville schools, where they're able to learn and also support teachers. And through a conversation with the director of this program, we've learned that they're working on revamping it. But as of this spring, as you can see from the visual, the sites that they focus on are largely middle schools and high schools. So basically our group is making the ask that if they're already working on revamping this program, that they should really focus on narrowing their focus to early childhood education and also facilities that would help the Nearport population. And lastly, Madison House has a daycare initiative where students go to daycares and provide assistance to the staff. And as Lily pointed out, we've been talking to Barbara Smith, the Assistant Director of Head Start, and Head Start is only able to help 200 students each year. So every year there are hundreds of families that are of the Nearport population on this wait list. And she refers these families to other facilities that may be able to support their financial needs. And as of right now, Madison House only supports or partners with 2 of those facilities. So Madison House, as other group members have pointed out, we really pride ourselves in volunteering, and there's so many UVA students who volunteer each year. And so Madison House and our wider Charlottesville community could really benefit from branching out to supporting more of these facilities.
First of all, I'm really pleased to be here today to talk through these projects. I'm so impressed with what you've all done, with what the whole class has done. I've had a chance to talk to a few students, Jennifer for one, during the year, and it's been a really, I've been impressed from the beginning with what I've seen people doing and the questions you all are asking, and to see these results is really fun, because I know how hard this work is to do this well. So begin with that. That said, there's so much here. These projects are so rich that the task Andrew and Sarah have given us to ask one question is really challenging. I'm going to go down to each of them, the details. But one thing that struck me was something that the reproductive rights group said about dignified motherhood. That phrase is a really powerful one, and I think it's a linking theme through these topics, through many of the others that we've already seen today, and actually through the history of this issue. If you look at the history of social policy and social service provision, one of the key problems is that the recipients have often been treated with deep disrespect, along with aspects of serious discrimination. But that denial of dignity is, I think, a key part of many of these problems with services that are received, and at a level even beyond that with the underlying problems themselves. So the question I'd like to ask each of these groups, each of the panelists, is how can we all, you as students, this is faculty and staff, because this is on us too, the wider community, how can we spark a conversation about dignity and what that means in relation to all of these issues here at UVA and beyond?
Well, I'll go first, yeah. In a healthcare setting, and that's primarily what I was looking at, I think it's treating everyone with respect. Going back to historical discrimination, African American patients weren't referred to as Mr. and Mrs. So something as simple as calling someone by their proper names and looking them in the eye and giving them the time to explain their story and is one step towards improving dignified motherhood.
Yeah, and I think that something that sort of fits in with the choice language as well with dignity is that when we think about these issues, it's very easy to ascribe words like that, but dignity means making things possible. So as the university employs many of these mothers, like this group is looking about, make it possible, give them a day off work, don't make it hard, give them a living wage. So yeah, dignity means options, I think.
Yeah, and going off that really quickly, I think that especially with abortion, like empathy is so important, and recognizing that there's no one reason why a woman might need to access that right. And one of the providers I talked with at Women's Health said no one gets pregnant in order to have an abortion, and it's just like having that level of empathy is so important.
I would agree that dignity definitely means options, and I think that includes being able to send your child to daycare, because there are so many women who feel like they have to be torn, and it's they feel judged if they do continue to work, because then, oh, you're not a good mother, and then they feel judged if they decide to stay home and look after their kid, because then, oh, what, you're not an independent woman? So it's like there's such there's so much that goes into it, and treating everyone with dignity and respect, and providing them with options, feasible options for them to make the best choices for their families is imperative.
And you also see that sort of lack of option in daily life. I know Bhakti was telling me a story about how she went to Rising Roll, which I'm sure we've all been to, and she saw one of the workers' children sitting in the corner playing a game or working on some reading, but clearly was early childhood education age, and she just didn't have the means to, put the kid in school and also sustain a job. So just really, I think UVA can also do a better job of making sure those options are available to the workers.
Thank you all. So we've reached the final panel for this morning, actually working our way into this afternoon. And just as a sort of a sense as to where we're headed here, we have, as soon as we're done with this final panel, we have catered lunch waiting for us out in the lobby. Everyone
everyone. We encourage you to stick around and enjoy that. Hopefully we're getting it set up right now. And then following that, we will be having our keynote speaker, Professor Barry Baldwin, who will be beginning probably around 1, maybe a little bit. We're going to sort of allow for enough time for this final panel, which will be asking the question, what's next? Where do we go from here? And what are some of the sort of challenges in particular that UVA faces on the horizon, and especially in light of what happened this past summer on August 11th and 12th. Let me briefly just introduce the panelists. We will start with Alex Hendel, Asir Saeed, and Eileen Yang, who will be talking about Charlottesville's refugee community in uncertain times. Following them will be Ian Dabney and Kagan McCabe, who will be talking about the criminal justice system here in Charlottesville in the wake of August 11th and 12th. And then finally, Nathan Abraham and Bradley Skeen, who will be asking the question that, again, is perhaps at the heart of all of this sort of projects we've been looking at today, which is why are college towns so unequal? To sort of bring this all together, we will be hearing from our moderator, Rachel Wall, who is an assistant professor at the Curry School, who focuses on how people on opposite ends of political divides can learn from each other, especially as regards policing and communities of color. So let us all welcome these panels and
Hello everyone, I'm Esther. I'm Eileen.
And I'm Alex.
And today we are presenting on the refugee population in Charlottesville. And so we wanted to highlight the global, national, and local statistics on refugees. So every 24 minutes, a person is forced to flee their home. This has resulted in 2017 for there to be over 65 million forcibly displaced persons worldwide. This has great ramifications on the U.S. as one of the only few countries with refugee resettlement programs. So in 1980, the Congress passed the Refugee Act of 1980, which has allowed 3 million refugees to have been resettled in the U.S. since then. And this has ramifications for Charlottesville because with our International Rescue Committee, refugees are resettled here every year. In total, there are about over 3,500 refugees in Charlottesville, and in the last 6 years, there have been 1,465 refugees who have been resettled. And this number seems small when you look at the 33 million refugees who've been resettled in Charlottesville, or in the U.S., but when you look at Charlottesville's population of 47,000 people, that is a great percentage.
Yeah, so we wanted to frame this around the question, where are these communities? Because I think refugees are something that are often in our sort of political discourse, but in Charlottesville, I'd say that probably many of us don't know exactly where refugees are resettled or don't interact with them on a daily basis. So what we wanted to do was cultivate a sort of spatial understanding of refugee resettlement in Charlottesville. To do this, we in the past few months have used a methodological mix of interviews with both refugees and people who work with refugees. We've done some archival research into local newspapers and into the International Rescue Committee's archives, and we've also looked at data from the Virginia Department of Social Services. But it's really been a process of trying to piece this all together because it's not really readily available information. And so when we say spatial, we mean spatial in two main senses. First, a sort of literal sense, looking at what spaces do refugees inhabit, what kind of hubs, whether they be sort of religious hubs or places of employment, what places are these refugees actually interacting with on a daily, weekly, and monthly basis. And this helps us look at questions of access, of distance, and things like that. And then we also wanted to look at space as meaning. So in this sense, the interviews were really helpful for this, to understand spaces as places where relationships are built, where communities are made, And in some of the things we'll talk about later, such as where refugees are settled in terms of housing, there have been interesting refugee communities that have formed out of these spatial locations.
So this graph highlights the refugee communities that are present in Charlottesville, and for the sake of brevity, we won't go into every demographic, but we wanted to highlight and juxtapose the presence of Afghan and Syrian refugees. So most Afghan and Iraqi people who are in Charlottesville have been resettled through the U.S.'s Special Immigrant Visa Program, which places priority and grants visas for people who have served with the U.S. government through positions of being translators or interpreters. And so this places a hierarchy of who is allowed to be resettled in Charlottesville, where you can see the dipping and decreasing number of Syrian refugees, while the Syrian refugee crisis has continued to exacerbate.
Yeah, and so one of the things we've done with this vision mapping is using this story map tool to kind of create an accessible way of looking at different services, at employment, at housing, and at religious institutions that are frequently accessed by refugees. And so here we have our services tab opened up, and we have things like the International Rescue Committee, but also things that you wouldn't necessarily expect, like certain elementary, middle, and high schools that have particularly high populations of refugees. And we also have the map on the side so that you can we can kind of situate this within a lot of the discussions that our classmates have been having about access, about distance, and about transportation to different places.
Can I take that? Yeah. So to situate this in a spatial analysis, I want to talk a little bit more about transportation as a big example of this. And so this is something that's been brought up in a lot of our classmates' presentations. So Lily talked about it, Olivia talked about it, Sydney talked about it, all in relation to different topics. Transportation is a really big issue in any local context. Specifically with regards to the refugee community, this really matters when you first arrive in Charlottesville. The IRC has said that they resettle almost all of their clients within Charlottesville's borders. And so that means they have access to bus routes, they have access to jobs, they have access to the cultural amenities of Charlottesville. Now, just because they're settled within Charlottesville doesn't mean they have access to all of these things. Two of the main destinations for IRC clients are Mickey Drive and downtown. So there's a bunch of areas downtown. And so downtown, when residents are there, there's a lot of access to things, especially if you don't own a car. You can take the bus routes, many of which end up around the downtown transit station. The issue is when you're settled in other areas of Charlottesville that don't have that same kind of access, the ability for you to get to jobs, get to schools, get to anywhere around Charlottesville can be a lot more difficult. So if you take a look at this right here, this is a comparison of the blue circles, which represent high quality, dependable bus routes in Charlottesville to population centers throughout Charlottesville. And so if you see all the way up at the top, kind of right underneath the title, or right underneath the name is Mickey Road, where a lot of refugees are settled. And as you can tell, there isn't dependable quality bus service up there. I think the only CAT bus that goes there is Route 8. And as Sydney mentioned in her presentation, it ends very early. It doesn't run that often. And having only one bus route can be difficult, especially when you need to access other areas. We talked to one gentleman, one IRC client, who used to live on Mickey Road. And as I think Olivia mentioned in her presentation, it's very difficult to access this bus route when the sidewalks aren't very connected, when it's so far away from where many people live, and so he biked to work. And so this is fine in a lot of the everyday context, especially when it's warmer out. But when it gets colder, when it rains, when it snows, it can be really difficult to bike all the way to the UVA health system where he worked. So that was actually a contributing factor for him quitting his job. And this is a big issue throughout Charlottesville, and throughout the placement and the space and the interaction of place and space for refugees in Charlottesville. This is an issue that is dependent on bus routes, but also where people are settled. where people can work. And when these things aren't aligned very well, it can be very difficult for people in Charlottesville, especially those who don't own cars.
You were third to last tab, so now what? Oh, that. There we go. Yeah. Hi guys, I'm Kate McCabe.
And I'm Ian Dabney.
And this is Now What? Analysis of Charlottesville's political landscape post August 11th and 12th, 2017. So before we get into the details, we kind of wanted to provide just a quick overview of the objectives of our presentation and our research. Our main goal was to analyze how the events of August 11th and 12th last year impacted the Charlottesville community and subsequently altered the political landscape. To do this, we evaluated social movements in Charlottesville, reacting to these events and others in the community, as well as following the relevant legal proceedings. At the end of the presentation, we will provide some of what we see as some possible solutions to the persisting problems.
So first off, how did we get here? Donald Trump's 2016 election sparked a massive resistance movement here in Charlottesville, headlined by former Mayor Mike Signer declaring Charlottesville as the capital of the resistance during a rally he organized on the downtown mall. However, making such a bold statement also put a target of sorts on the city, as Trump's supporters ironically felt attacked. For instance, Jason Kessler, a UVA alumnus and known white supremacist, brazenly drafted a petition to remove Vice Mayor Wes Bellamy from office, the only African-American council member on the city council, citing a series of tweets from a couple years before as reasonable cause for his removal. In other words, Kessler's move, coupled with Signer's reassuring words, foreshadowed that Charlottesville could, and probably would, become a major site of conflict. For the sake of brevity, we won't expound on the specific tragic events of August 11th and 12th, but we see that weekend as the zeitgeist for the surge in both social and political activism. More specifically, we see it as a crucial moment on both sides, so to speak, for decisive and divisive institution building, especially given the surge in white supremacist organization membership following Trump's election.
So we looked at the response to the August 11th and 12th incidents in two forms. We broke it down into activism and institutional responses. So looking at the activism side, we first began with the city council meeting on August 21st, which was the first council meeting right after the events happened. Predictably, community members were frustrated with the lack of action both on the city's leaders and its institutions, and showed up and took over the meeting. As many of you may know, 3 people ended up getting kicked out of that meeting. They jumped up on the stage and held a sign that said "Blood on your hands." It was, of course, charged at the city's leadership for not doing enough, and of course, eventually leading to a tragic death. On the same day, students and the groups that they represent led the March to Reclaim Our Grounds here on campus, where they presented a list of demands that included removing Confederate monuments from grounds, especially the lawn, and hoping for a requirement to change the curriculum that requires students to have training and education, of course, on issues of race as they relate to UVA and Charlottesville.
And on the institutional side, over the course of roughly a month, President Sullivan sent some fairly generic and thus lackluster emails condemning the events and emphasizing the need to work together to enact meaningful change. Meanwhile, Derek Aldridge, a professor in the Curry School, opened the Center on Race and Public Education in the South, which he was quoted in saying he would hopefully act as a driving force for change on both a local and national level. Then, on November 24th, Timothy Heaphy, acting on a contract from the city, published a scathing 207-page report regarding August 11th and 12th, citing woefully lackadaisical behavior from the Charlottesville Police Department, especially focusing on Chief Al Thomas. Moreover, according to Heaphy, Chief Thomas directly inhibited his access to police information, which is especially pertinent given that he resigned merely 17 days later. It's also important to note that Thomas was Charlottesville's first black police chief.
From a political standpoint, in the midst of all this chaos, local politicians were campaigning for city council elections, highlighting August 11th and 12th as the basis, at least somewhat, for their platforms. Taking some strong, in a lot of cases, such as Micaiah Walker's stance, who, as a black woman from Charlottesville running as an independent, one would think might not have that great of a chance. But of course, along with Heather Hill, both of them ended up winning, with Walker being selected as the mayor, signifying a both ideological change in landscape and indictment of previous leadership.
So what's next? We believe Charlottesville is going to remain an ideological battleground, whether that be positive or negative, we're not really sure yet. As we've seen in the past, it's kind of been a negative. So of course, the debate over the Confederate statues is going to continue. Charlottesville is in the middle of a period of trying to reconcile its troubled past, just like cities all around the country are. I think it's going to continue to go on as we know the legal proceedings are still happening. Similarly, we expect the debate about free speech and free assembly to go on. I think this is a problem that's happened all across the country, especially on college campuses. There's been a wave of similar debates. UC Berkeley had a thing where they shut down some white nationalist speakers and it ended up in riots and violence. So we need to figure out how to deal with these situations as academic institutions that claim to be progressive. And of course, the legal battles stemming from August 11th and 12th are going to continue on. Luckily, DeAndre Harris, who many of you may know was infamously beaten in that video in the parking garage, had been cleared of his charge of assault, but there's still cases going on involving other people like Corey Long and Donald Blackney, who were other black men charged in the wake of the incidents. So ultimately, we believe that the response from the citizens and the city's institutions are going to determine how these new events will play out. So a way forward. To finish up some of our proposals aimed at ameliorating the problems that we've identified. First, we believe definitely a stronger institutional response is necessary. Speaking as students, we've been pretty disappointed overall with the response and believe there's definitely room for improvement. That goes beyond dialogue. I think, speaking for myself, but I think maybe for others too, that we're a bit tired of dialogue and we kind of want some action. Because of dialogue fatigue. And then based on the social activism that we've observed in the past few months, I think the sentiment is shared in the community. We also think that this community engagement continuing is vital. We've been super encouraged by how, I guess, ferocious the response has been. But I think one of the things that we noted is, in general, the social movements in Charlottesville have been reactive rather than proactive. You can see, if you even just look at like the Facebook page and the events that different organizations put up, they're most of their activity was to host these events. So I think if they were more proactive, they probably could have maybe done some prevention from this ideology terrorizing our community in the first place. Another option, which I think might be a bit controversial, is to reevaluate our policies on assembly. It's a kind of touchy topic, of course, because there's constitutional protections that go along with it, but I think that if a group applies for a permit to demonstrate in public, there should be stricter restrictions on what they're allowed to do. For example, guns in a public space while people are demonstrating doesn't seem like the best idea for me, as it creates a pretty much just an environment that's naturally threatening and intimidating, and it really, really restricts the options of people that are counter-protesting as well.
And just generally speaking, just to really briefly wrap up, we think that we would really like, as students, and from what we've gauged and what we've read, the literature that we've read, we don't think it, in today's day and age, there is no reason that police should have happened. There shouldn't be brawls, there shouldn't be that conflict, and even more so, given that there was that conflict, it was incredibly embarrassing how long it took to bring justice. In fact, justice hasn't fully been brought to the people involved, and that's why we made this timeline, and that's why we've done this research. Thank you very much.
Awesome. Hi, everyone. My name is Nathan Abraham. Hi, guys. I'm Bradley Ski. So we'll be looking at very broadly why college towns are so unequal. So we'll start with that question, but narrow in on what some college towns have done to try to kind of reconcile this inequality. We'll start by kind of painting this general picture and going through the dynamics of a college town that kind of provide the reasons why when you look at a list of the most unequal towns in America, college towns are heavily populated on that list. So we'll go into a case study of Chapel Hill, North Carolina, which is a community that seemingly has bucked this trend. So we'll look at how they've done that and what kind of ramifications this impact might have. We'll look into the implicit or explicit impacts that lists of best places to live and best college towns to attend might have on these dynamics, and then we'll finish by taking it back to Charlottesville, looking at what our recent history might suggest we're moving towards and kind of what we can do as we move forward. Awesome. So we will start by painting this picture of the unequal college town. So it's fairly intuitive how this dynamic might develop. On one hand, you have a very wealthy, educated population base made up of students, alumni, professors. So you have a large population that has a lot of wealth and resources. But on the other hand, in almost every college town, or pretty much in every college town, the biggest employer is the university. And at any university, you need a large staff of low-income workers that need to staff the dining hall, that need to clean the dorms. So you create a really great juxtaposition between two communities that have very differing levels of wealth, that create really high Gini coefficient indexes and really high rates of poverty. As you can see in Charlottesville, Chapel Hill, Athens, Georgia, which is the home of the University of Georgia, and Tallahassee, Florida, where Florida State is, really high poverty rates exist well above national averages. Now, the child poverty rate is often used in college towns because sometimes the off-ground students can sometimes inflate some of the poverty measures, so a child poverty rate kind of controls for this student population, and you can still see that the rates are well above the national averages in every city except for one, and that's Chapel Hill, North Carolina. So why might this be the case? One thing that you can see as the poverty rate, specifically the child poverty rate in Chapel Hill, has declined over the past few years, is that there's been a counter trend that has also mirrored this image, and that has been the decline in the black population of Chapel Hill. So you have to really start with the racial history of Chapel Hill in the Great Migration. So black people moved up from the South following the abolition of slavery and settled in North Carolina with the prospect of jobs at the University of North Carolina as kind of in the service industry. They settled in this conglomeration of neighborhoods known as North Side. So this is kind of became quote unquote the service neighborhood of Chapel Hill, and this is where a lot of low-income black residents settled and eventually created a really thriving community and culture. Now, in around the 1980s, the University of North Carolina really started to expand, and specifically student housing started to encroach upon this historical black neighborhood. So as the university expanded its resources, they began to displace the residents of the neighborhood, and you saw stark population decreases in the North Side. As a result, the black population has decreased by 40% from 1980 to 2010 in North Side. And perhaps more striking, at the University of North Carolina, the faculty and staff and workers, that's the dining hall workers, the dorm workers, over 60% of these workers live over 10 miles away from the campus. So that's not just living outside of Chapel Hill, but that's being relegated to the surrounding county areas where it's much more harder to track these people that might have more cases of poverty. So we basically saw kind of two ways that poverty can be addressed in an area, specifically within the city's limits. So you can kind of try to bring up those from the bottom, or you can just push them out to the surrounding areas where their statistics are no longer tracked and included in the city's count of poverty statistics. And it seems like that's what Chapel Hill is adopted.
Now, moving on to rankings, and to be like a clarifying point on that last thing that Nathan just said, it seems like Chapel Hill has made that decision to do that, but it's very important to recognize as well that that is almost like an kind of involuntary process. It's one that happens naturally, and kind of moving on in that trend of talking about what occurs naturally. We saw when we were looking through, ranking lists of the happiest towns in America. There were a great deal of college towns that did make this list. You can see some of the metrics that are projected, places that are perfect for the people that live there, high standard of living. We noticed that there are very different, there are disparities in terms of the two kind of populations that are being served by college towns. This being, the population that has lived there historically, that will reside there for more than 4 years, and then the 4-year kind of population, the transient population, that the students comprise. So this leads to a big disparity in terms of what college towns choose to prioritize. And this is a simple manifestation of this, for example, could be a college town choosing to construct like a bike path and that sort of infrastructure that will appeal to students that want to come to the college town and be active, rather than bolstering public housing or that sort of thing that would really help uplift and benefit the population, lower income population that resides in the college town.
Absolutely. And the important thing to note is that these college towns are in constant competition for the brightest students, the brightest faculty, the brightest alumni to come back to their towns and to contribute. So they have an implicit desire to be able to, so these rankings are conducted through interviews with people like Gallup and Forbes call the house of residents in Charlottesville. So there's an implicit motivation to be able to have the best performance on these metrics so that they can have that competitive edge and continue to draw the best students and faculty into their cities.
Right, so shifting to Charlottesville, Nathan addressed North Side in Chapel Hill. We're going to talk about two kind of modern neighborhoods that are in a lot of ways tantamount to the process we saw in North Side. Beginning though with Vinegar Hill, this is something that our housing group alluded to earlier and did a really good job of describing. But sifting through stories, listening to accounts by residents that have been in Charlottesville for generations, Vinegar Hill is something that is never going to move outside of the minds of the Black population in Charlottesville. It was an incredibly traumatic event and one that displaced 500 residents and a great deal of commercial growth in the area. So kind of moving past that to the more modern displacement in Charlottesville, two neighborhoods that the housing group alluded to are 10th and Page and Fifeville on either side of West Main Street. Neighborhoods that are being encroached upon by these massive constructions on Main Street, standard, uncommon, flats, but also through a wealthier, younger population, like professors, venture capitalists, those sorts of groups are also moving in and gentrifying, displacing residents that reside and have resided in 10th and Page and Fifeville for literal generations. So getting, Nathan kind of talked about like an intuitive kind of concept earlier. Another one might be, the fact that property values are rising in these neighborhoods. That's a good thing, right? That's something that people want. But a concurrent shift that happens with these rising property values are an increase in property taxes, which make it just simply not viable for lower income families to continue to reside in those neighborhoods. And it just leads to inevitable displacement.
Absolutely. And this is not a trend that's just apparent in Charlottesville. So in the first slide I showed Tallahassee, Florida, Athens, Georgia, and we didn't throw Oxford, Mississippi on there. But this is a trend that's very common in these college towns. So in those that still have really high levels of income inequality, you see student housing consistently encroaching on these historically Black neighborhoods because they have the room for urban renewal or development.
Thanks so much. So to conclude, we're talking about what can we do moving forward. I think it's really important to be cognizant of the kind of the political environment that we're in right now. The group that went prior to us alluded to Nakia Walker's election to city council and then appointment to the mayor position. I think that is so vital. Let me explain why that is. So when we were doing research on Chapel Hill, we looked around for kind of allusions to affordable housing issues and allusions to kind of fear that residents would be displaced. And we didn't come across anything. Kind of the displacement that we saw in Northside just occurred with very little publicity and very little mention by residents. It was not publicized and no groups were working to make their voices heard of the residents that lived in Northside. Now that is not the case in Charlottesville. We have symposiums and talks on affordable housing constantly. We do have great groups in the area that do work with low-income residents that are being displaced. That's not to say that exposure inherently ensures progress, and it doesn't mean that all these voices are being given the credence that they need to be given. But I think it's vital to recognize that Nakia Walker would not have been elected if there wasn't still a population in Charlottesville that cared about affordable housing and wanted to see change. And we're living through the things that we're talking about right now, because we're not living through it. We're actually enabling it as students. I think that's so important to recognize. So, there is still potential for progress in Charlottesville regarding housing. It just needs to manifest in letting the residents who are living through it tell their stories and force change within the city council. So thank you very much.
Thank you so much. Like the last moderator, I wish I had time to ask all three of these groups detailed questions because those were all really compelling presentations. But with the one question, what I'd love to know is, since these presentations came out of the course that you were all engaged in throughout the year, I'm curious about how questions could be something like, what is the responsibilities that cities have to refugees? How should institutions such as universities respond to white supremacist speakers on campus? What are the obligations that universities have to low-income populations that they've displaced and continue to displace? And to keep those as open questions. Another approach is for faculty to say, actually, we are living in times of legitimate political emergency. These issues are pressing, and I'm going to garner the evidence and resources and position of authority that I have to show students a particular stance and why it's persuasive, how they have a responsibility in particular ways. So I'd be interested in hearing from each of you how you would like faculty to approach these issues.
So I think classes that are framed in this way with political, or I guess local engagement, we all attended, I guess, community meetings last semester and sat in on those and kind of interacted with people who are doing the groundwork, whether that's citizens and residents or people on those boards. I think that's vital because speaking on behalf of like articles that have been released in the Cavalier Daily, the student newspaper, I'm not going to bash on them, but they've shown a very limited perspective of these issues, like gentrification, for example, and kind of what these communities are facing. And when I say limited, I mean that they have literally no input from actual residents living in the area. That's hugely problematic. I mean, I'd know nothing about this situation if I actually hadn't, talked to and learned from actual residents in Charlottesville. But I think because of that, courses like this are very important because they facilitate actual connections between us and between real people.
Yeah, I would agree with a lot of that. I think the tendency when you have the style you mentioned where you might pose an open question, I think the tendency is to go into theory about why that might be the case. But I see no problem in asking an objective question if you back it up with real local context. It's kind of founded in what's going on around you. And I think kind of getting away from that tendency of just hypothesizing about what might be the best thing, but really analyzing kind of what that answer might be in your own city can really be an effective way to address that.
Yeah, and I think sort of branching off of both of what they both just said, like we were, from day one of this class, the onus was on us to invest not so much in what we were doing in the classroom, but what we were doing outside the classroom. And for our group, we were in the courts, doing court watching, and watching one UVA student versus 6 people in the community being tried, it was pretty obvious who was the UVA student and who was in the community. And I think that unprecedented access into the sort of surreptitious underpinnings of the city and the justice system gave us sort of a larger scope on life and on just understanding how these issues work, and more importantly, why they still are issues. It's not news that institutions in Charlottesville are racist. That isn't new. But sort of seeing it firsthand and experiencing it and not being able to shy away from it is what made this sort of a worthwhile endeavor. I don't know if you want to add.
Yeah, I'd say one thing that I was thinking of when you asked the question, you posed it as open-ended questions or authoritative statements. And I think in our hyper polarized time, we're kind of scared to make authoritative statements, especially when it comes to issues of race and things like that, because so many people are just uncomfortable talking about it. But I think we have to get past the fear of the polarization, because I think it shocks us from telling the truth. And I think there's a lot of times where facts now get politicized, and I think that's ridiculous. And especially on issues like gentrification, race, displacement, all these types of things. There's facts about these things. It's not an ideological. There's no way you can ignore the fact that people are getting pushed out from their communities, or the fact that people of certain ethnicities or races, whatever, have statistically lower income, things like that. Those are problems that are structural, and they've happened throughout our history. And I think we have to both recognize and acknowledge them, and also just not be afraid to talk about them.
Yeah, I think this is an interesting conversation to be having now, because UVA is considering putting in a core curriculum program, and currently they're running the forums as a kind of trial run of that. So, and I've been in some conversations with faculty about this exact question of how do you kind of raise things like racial awareness among all first years who come into the university. And although I do think that it's important to have open debate on a lot of issues, I also think that there are some issues that there is a very clear-cut right and wrong on. So like the events of August 11th and 12th and sort of the entry of white supremacists into Charlottesville, I don't see that. I don't see that as much of a question for debate as much as it is something that professors and students have responsibility to talk about in a critical way.
Which question?
So if we're talking about like white supremacists,
Whether they should be allowed.
yeah, whether they should be allowed. And so, yeah, in that case, I think that professors and students do have a responsibility to take a strong stance on that. But I also think that a lot of times it's not even about whether or not there's debate or there's just authoritative stances on it. It's about whether or not these topics are even broached in a lot of classes. And if you go to like dominant departments like politics, often it's difficult to find classes that deal directly with questions of race or will engage critical questions about our sort of contemporary context. So I think it's also important to just have more visibility and exposure to those issues in departments like politics and not only have those sort of siphoned into area studies, into African American studies or into like WGS, things like that.
And also, I think to build on that with the context of our project on refugees, on my walk over here to the Symposium, I ran into a friend and was telling him about my project and what I was doing today, and he said he had no idea that there was a refugee population in Charlottesville, which I think illustrates exactly what our group is focused on and the questions that we're asking, and I agree completely with Eileen that we need to be bringing these questions and these communities to the forefront.
I think that building on what my group members have said, I think this goes back to the issue of perspective, and Bradley brought this up and talking about it happening daily. I think specifically with our project, this is something that not only do we not get a two-sided perspective on with regards to refugees, but this is something that's never even talked about at all. And so some of these issues, there are two perspectives. One may be more correct than the other. But on a lot of these other issues, there's no perspective at all, and that's where it's important to dive into these issues and learn more about them, not just from a perspective of authority, but from a perspective of just listening to people, listening to their experiences, listening to their perspectives. I don't think any of us can ever understand really what it's like to be a refugee, but that doesn't negate the importance of hearing these different perspectives and trying to get more of a grip on individuals' experiences in this context.
Well, let's give one more round of applause. Not stressing out college students with all the work that our students have been doing this semester. And just as all politics is local, so too is food. And in particular, we hope you will stick around and enjoy a catered lunch out in the lobby from Pearl Island, local food caterer and the delicious Jamaican, Caribbean.
And we promise not to cut off your questions.
Yes, so please stick around. Yes, so please stick around. Let's talk. And then after we have a chance to grab some food, we will come back in for our keynote address. And we really look forward to continuing this.